And hello, everyone. I'm very honored to be here and to speak to you about this topic, maternal health connectivity in low-resource areas and the potential of blockchain. And I'll dissect that title a little bit for you. But first, I'll briefly say something about me, but Claire already said a few things. I grew up as a child for half of my youth, for the first 2 years, and the second half of my youth in Kenya. After that, I came back to the Netherlands to study, and I became an economist. And I then worked for the government for a few years, and then I became a freelance economist, interested in, my area of expertise is competition economics and the way markets work, and I'm also interested in healthcare. In fact, the topic of value-based healthcare that we heard from Ari earlier is something that interests me very much. I then became a husband, and my wife was a doctor, and she decided after a few years as a doctor in Obs and Gyn that she wanted to become a doctor of tropical medicine. And when she made that decision, I said, well, you know, when you are a doctor of tropical medicine and you want to go and practice that in the tropics, I'll be more than happy to join you. She then became a mother first, and I a father. We had our first daughter. But shortly after that, she found a place in Haydom Lutheran Hospital, which is in rural Tanzania. It's in Manyara region. It's in the northwestern part of Tanzania. And it's a large regional referral hospital. I joined her there, basically just as a father and maybe a volunteer to the hospital first, but within a few months the hospital lost its finance director and asked me to join their ranks in the board of management. Now, I didn't become the CFO, thanks for that. Unless you say F stands for fundraising. I became the fundraising officer and I also had to do external relations and IT, but I didn't feel I could take on the finance responsibility in that setting because I'm not a financial economist. But today I am someone pursuing an idea, and I will talk to you about that idea a little bit more here. So let's go back to the title. Maternal health in low resource areas. I've put up 3 pictures from the area around our hospital, from a photographer, not myself. And these pictures are taken at a outreach site. So what's happening here is that our hospital has 24 mobile outreach clinics, where each one is visited once a month, and the women in the area know that there will be an outreach clinic from this hospital on a specific day. So they will come to the place where this mobile clinic takes place, and the doctors and the nurses go there. And in this case, for this clinic, it's a church building that is not quite ready, as you can see. But you know, that's an excellent area because there's shadow and there's probably benches and desks. So that allows for some of the work to be done in a comfortable way. And as you can see, you can come there as a mother with your child, and you can weigh your child, but maybe you can weigh the mother. In some cases, those skills would literally be hanging from a tree. This photograph doesn't show what it's hanging from, but you know, this way the doctors or the nurses can track the progression of the baby. Is it growing, or you know, should we be concerned? And in the same way, I think this graph over here, I'm not a doctor, but I think this graph is about progress in the prenatal stage, and in some cases, doing these kind of checkups. For some women, you may find you should really come to our hospital now because there's some reason for concern. You know, you shouldn't continue to be just in your own home. Let's have a closer look. Now, the hospital has plenty of technology and doctors and you know, ways to delve deeper into whatever problem there may be. So this is maternal health in low resource areas. Now, this is if you look at these pictures, we're very low on technology here. You know, try to find electricity cable, and I promise you they run above ground. You know, this church is not connected to electricity, and probably there is no electricity in this area. As you can see from the scales and the paper, you know, this is a low technology area. And then the other part of the title is connectivity and blockchain, which, you know, conjures up images we've all been exposed to the news. You know, the connected global village where everyone is online and everything you do is in the computer, and the whole digital world. So to me, those two things are sharply in contrast with each other. But nevertheless, I'm going to talk about their relationship. And I learned from Sunil that we should be talking about the emotional component. So I'm going to share a story that's very personal to me first. This lady was in the postnatal ward of our hospital. I had walked into the postnatal ward because I wanted pictures of babies and mothers with their babies, because as a fundraising officer, I knew that showing those pictures was a direct way to show our partners what their funds were doing in our hospital. And I took a couple of nice pictures, but in the middle of the room there was this super radiant lady, and that's her, Rehema, and she didn't have a baby yet. Well, she did. She had a very big belly, but she was in the wrong room, and the reason was that she had some friends in this room, so she decided to go there and chat with them. But she was in the antenatal stage, and she was by far the most photogenic person in that room. She later figured as the front page of our annual report as well. But the funny story, and this story is about not the benefits but the detriments of technology sometimes. I ran into her about 2 weeks later, and you know, when I took this picture, she had a big belly. 2 weeks later, I ran into her, and she had an even bigger belly. And I said to her, "Hey, sister, good to see you. I see you still haven't delivered. What's going on?" And she's like, "Yeah, I don't know, but I feel great." And I said, "Well, have you considered, do you have twins maybe?" And she said, "Well, it could be, I don't know." I said, "Well, haven't you had an ultrasound?" And she said, "No, I can't afford it." And I knew that the ultrasound was, you know, 10,000 shillings, which is $4. So I said, "You know what, have these $4, go have an ultrasound, you know, find out if you have twins." And she did, and she did. But the ultrasound showed 2 babies, but they couldn't see the head of one of the babies. And suddenly this was a potentially complicated delivery. And she was signed into the cesarean section process. She had a cesarean section, and she had 2 completely healthy babies, which was really nice. I went and visited her, of course, with my wife in the postnatal room. She was super happy, 2 healthy babies, but she had to pay for the C-section, which is 5 times a higher cost than the normal process of labor. I then paid that for her, of course, because I felt guilty that, you know, if I hadn't encouraged her to go and do an ultrasound, nobody would have known that she was carrying twins, and she would have probably had a spontaneous delivery. This was a super healthy lady. You know, she had a good chance of a spontaneous delivery. So I had somehow pushed her into this technological side, and that pushed her into this C-section, which you know, which illustrates that technology doesn't always help, but of course, you know, we all know that it can help. And another aspect of technology, I've just taken some pictures from a search engine, low resource Africa and mobile phone usage, or some such search key, and then you get these kind of pictures. I just want to illustrate that the mobile phone is ubiquitous technology in low resource areas. Where we were, which was really one of the most low resource areas that you can go in Africa, almost everybody had a phone. And if they didn't have a phone, they had a relative with a phone. And these things are really cool because they connect you through a network that is always on. The mobile phone operators earn their money very effectively by keeping their network up and running. So they have their own battery packs at the bottom of the masts. So this network works, and these mobile phones can be charged on solar. So, you know, your handset works, even if there's no adequate power supply in your region and if there's no good internet connection outside of the 3G network. So this is very, very relevant technology in low resource areas. And then the other part is blockchain. The other part of what I'm talking to you about is blockchain. Now, who of you has heard of blockchain? Let's have a show of hands. Who hasn't heard of blockchain? Okay, so you're in the minority, but it's more or less as I expected. And then who's heard of Bitcoin? We already heard the link between Bitcoin and blockchain. Who hasn't heard of Bitcoin? Everybody's heard of Bitcoin. Okay. I'm not going to explain to you what blockchain is at a technological level because I need some time, and I'm assuming that those of you who are interested enough to find out what blockchain is, you can go to a search engine and type in blockchain intro, and you will find really relevant and easily accessible texts and pictures explaining what blockchain is. But I'm going to talk to you about the consequences of blockchain as a technology and the importance that may have for this low resource setting. And there's a couple of concepts in blockchain that I want to briefly mention. First of all, a system of proof. Blockchain is often referred to as a system of proof, and the reason for that is that if you use this technology, which we call blockchain, to administer something, to write something down, once it's in there, nobody can change it. It will be in there forever. It's a written record that is unmutable. Nobody can change it. So then if you use that fact to get to the next fact, and you also administer that in this chain, this blockchain, then you get an auditable trail of information that leads to whatever truth that you're trying to prove with that information. So it's a system of proof, and it works without any organization or government or company or NGO at the center of it. It works as a system. It's actually software that sits on many computers and can carry out these tasks. So it's revolutionary because it allows you to track facts in a way that nobody can tamper with, and that over time just become facts that you can trust. So it's a system of proof, and it leads to trust. Sometimes we hear the term trustless trust in blockchain. That means that you don't have to trust a company, you don't have to trust a government to keep a record of something, you only have to trust the system. So there's this system of trust without an entity at the center that you need to trust. And that is something revolutionary. And I'm not going to talk more about that. If that interests you, read about it, because it's really, it is something revolutionary. Distributed ledger technology is another term you'll run into with blockchain. That's about how it works. Sovereign identity is another term that's really interesting. It's about how you manage your identity in the digital world, and it's something that's made possible by blockchain technology, and it's something that's also relevant for this idea that I'm pursuing. So I want to talk about the potential revolutionary power of this new technology that you can call blockchain, or you can call it more broadly distributed ledger technology, or just the idea that you can have a system that's decentralized and that can work for the people who use it without a company being at the center and trying, like Facebook, trying to use the information from those people for its own gain. This new technology allows a system to exist without having to have something at the center, whether it's government or a for-profit company, or a not-for-profit that you may not trust. The revolutionary power that really interests me, and that is at the heart of this idea that I've been pursuing, is the personal health record. Now, who's heard of the personal health record? Can I have a show of hands again? 3, 4, okay. So I need to explain that a little bit. It's a concept that in the West we are starting to get quite interested in, but we run into obstacles related to the status quo, because the status quo in how we organize the health record of a patient is that when a patient goes to a health provider, in the transactions between the health provider and the patient, information comes into existence about that patient, new information, a lab result, or a radiology picture or an observation from a physician. That information traditionally is stored by the health provider. You know, in the past it was written down. At some point it was typed, then typed into a computer. But throughout that evolution, it was always stored within the physical walls of the health provider. And only recently have we started to see that that same information could be stored with the person who's concerned rather than with the health provider. And when you do that, it's really interesting because a person, from the health provider's point of view, there's all these people that come to it as patients and you can keep all their records. But from a person's point of view, there's all these health providers that you may go to. And each health provider has a different function in your health. In the Netherlands, you might typically start by going to a general practitioner. If the general practitioner thinks that you should pursue the question that you came to him or her for, he might refer you to a specialist. The specialist keeps his own, a specialist in a hospital. That hospital has a record about you. The general practitioner has a record about you. If you turn it around, the general practitioner will add some information to your health record. Then you go to the hospital will add some information to your health record. If you are interested in alternative medicine, something that I know is very controversial, especially for most people in this room, but say that you as a person are interested in that, no one's going to stop you to go to that alternative practitioner, and that person will again generate some information about you and add it to your record. All the while your personal record is growing, and there's big advantages to that because all the information is in one place, first of all, and it's in the best place because wherever that person is going to be with a health question, the health record is going to be as well. Suddenly there's no interoperability questions anymore, something that we've been struggling with in the Netherlands for a number of years. Secondly, the revolutionary force of blockchain technology is for IT questions in hospitals in low-resource settings. Now, I helped this hospital transition to a patient record-based system, a computer-based system, which worked, but my observation was, two observations. We duplicated a Western solution in a completely non-Western context. We first had to teach all the staff to use computers. These were skilled and trained staff, but in their training, they'd never used computers. They all had smartphones, because anyone with a decent income, even in Tanzania, has a smartphone. So they know how to use an Android-based system, but they don't know how to use a laptop. We had to train them to use laptops and workstations. Second of all, there was huge donor pressure on this particular hospital to implement this solution, and that's why we succeeded. But I don't think many hospitals will experience such strong donor pressure and then successfully roll out a patient record keeping system. So those two observations got me thinking, thirdly, I observed that the hospital really benefited from the IT systems, and the patient really benefited from it. The services became much more organized for the patient, and the turnaround time for patients dropped drastically. So I saw there's potential for IT, but the way we did it isn't really the solution. But now enter blockchain technology, enter this trustless system of trust that allows you to store information, for example, as a person, to store your own information in a way that you don't even have to trust any organization that's at the core of that. You only have to trust that that system as a whole works. And then you come to this vision. It should be 15 words. Let's say 15 words per bullet. Imagine that anyone with a mobile phone can own and manage and share his or her own medical record. And imagine that any health provider can then utilize that platform as an effective patient record keeping solution at a very low cost. And just try to imagine how this will impact public health all over the world, and who would be excluded from this innovation. And do I still have time, Claire? Yeah, do I still have time? Because then I'll make this a little bit specific for maternal health.
Couple of minutes.
Okay. If we go back to these pregnant women, or to maternal health in this setting, going back to the emotional. Imagine you are pregnant and you've walked to the closest health provider for your first screening. And at that screening, a friendly nurse saw you and started a record about you. And the next time you go back to this provider and you find that you're treated very poorly, but your record is there. Now you feel locked in to this provider, and you start getting doubts as an aspirational mother. You start asking yourself, did I pick the best place to have my postnatal, my antenatal care, and is this a place where I want to have my baby? But you feel locked in because they are building up this information about you. Or perhaps they have this previous information because you went there as a patient. Perhaps you're a diabetic, and they have that information on their files, and you feel unsafe to go to a different provider who doesn't know about you yet. So you feel locked into this provider. That's not a nice place to be. Now, if you are the owner and the one who carries around your medical record, of course you don't carry it around physically, but your mobile phone enables you to share this with whichever health provider you want. You might hear from your neighbor that she had this wonderful experience with this other health provider that's maybe half an hour further travel. And suddenly you feel empowered to go there because nobody owns you. You didn't get locked into any health provider. You are the owner of your health, and you are the owner of your health records. I think that in itself is a potentially beneficial. I thought of another example in maternal care, but I'll save you the time, or I'll save the next speakers the time as well, and allow everybody to get on with the day, or the end of the day. There is, of course, huge opportunities from this. I don't have to explain those. This is what my idea is called, Mimoyo. This is what I'm pursuing. I call it an idea and not a startup because I haven't got funding yet, but I have got a group of people involved in this and a plan, and we're expecting to roll this out soon to start piloting. Our plan is to pilot this at a small scale first, and then hopefully, like we saw in Brazil, maybe we get a 5x and then maybe another 5x, and who knows where we can take this. And I really want to thank everybody for listening to me, and if anybody is triggered by this and has a question, I put my email address up, but same as Sandra, I put it on a Mac, and apparently the aspect ratio is different. So if anybody wants my email address, it's jr@mimoyo.org. And please, if there's any thought or question about this that isn't addressed now, then please feel free to drop me an email.
One question, quick question. Sorry.
Jonas, do you think it possible that this model you are using could be used? In the Netherlands, everybody has already all this digital patient information system, at least each hospital.
Yes.
Could this model also be used by patients in our hospitals who want to put some of the information about themselves they hear to stock it for their own purpose for future use or for research if they want to participate in research?
Absolutely.
I'll call you next week.
So any other questions can be done by mail, and people who want to do some funding, I think, for you, to help you.
More than welcome.
And also join you by mail.
Yes.
Thank you very much.
Thank you very much.